How much does bone grafting cost in Turkey?
The cost depends on how much bone needs to be rebuilt. At Dentafly, bone grafting starts from around £150 for minor procedures, while more complex bone reconstruction can cost up to £1,500. Even with premium materials and specialist care, patients can save significantly compared to private treatments in the UK.
Is bone grafting painful?
Not at all. The procedure is carried out under local anesthesia, so you will not feel any pain during the treatment. For patients who are anxious, we can also provide sedation to make the experience even more comfortable. After the procedure, you may have some mild swelling or discomfort for a few days, but this is really normal and managed with medications.
How long does it take to heal?
Your gums usually heal within about 2 weeks, but the new bone takes around 3 to 6 months to fully integrate and become strong enough to support a dental implant. The exact healing time depends on the size of the graft and your body's natural healing process.
Can I have a bone graft and implant on the same day?
Yes, of course. In some cases, if only a small amount of bone grafting is needed or we are placing an implant immediately after a tooth extraction, both procedures can often be done during the same appointment. For larger bone grafts or sinus lift procedures, it's usually safer to allow the bone to heal for a few months before placing the implant.
What's the success rate?
Bone grafting has a very high success rate when it's properly planned and performed. Using high-quality grafting materials, modern techniques, and experienced implant surgeons, the success rate is typically between 95 and 98%.
Will my body reject the graft?
This is extremely rare. We use high-quality, clinically approved grafting materials that are specially processed to be safe and biocompatible. They act as a scaffold for your own natural bone to grow, so the graft gradually becomes part of your jaw over time.
Can I fly home after surgery?
Yes, most patients are able to fly home safely 48 to 72 hours after the procedure. Before you travel, we will examine the surgical site and make sure everything is healing as expected.
Does the NHS cover bone grafting?
In most cases, no. Bone grafting for dental implants is generally considered a private treatment in the UK, so it's usually not covered by the NHS except in very specific medical situations.
What if I'm a smoker?
Smoking significantly affects healing because it reduces the blood supply to the gums and the bone. This increases the risk of complications and graft failure. We strongly recommend stopping smoking for at least 4 weeks before and after surgery to give your treatment the best chance of success.
How do you ensure quality AACI and ISO?
At Dentafly, we follow strict international standards for patient safety and clinical quality, from advanced 3D digital planning to premium materials and modern sterilization protocols. Every step of your treatment is carefully planned to achieve predictable and long-lasting results.
Can I combine with my implant treatment?
Yes, if one area of your jaw requires a bone graft, but other areas have enough healthy bone, yes, we can often place implants in the healthy areas during the same visit while the grafted area heals. Your treatment plan is always tailored to your individual needs.
What's included in the all-inclusive package?
Our package is designed to make your journey as simple as possible. It includes your consultation, 3D CBCT scan, bone graft procedure, premium grafting materials, medications, hotel accommodation, VIP airport and clinic transfer, and full support throughout your treatment. We also provide convenient aftercare for our UK patients through our Wembley, London clinic.